war known to man, I believe this is true, somebody got killed on the last day. So let's just stay the course. Please stay at home. Keep your distance. Keep us getting the map that looks lighter and lighter every time we pull it up. With that, Judy will correct the record.
Yeah, I think that as we look at the hospitalizations, we are seeing some flattening. And we separate out the state into north, central, and south. And we actually are seeing the progression, or I should say the transmission of the disease moving down the state. But overall, we are seeing a flattening. That was the consensus of the group that met this morning and looks at these trends. So we're optimistically hopeful. Cautiously, optimistically.
Nothing new on heat, and why nothing on self-serve gas? Although I really like having my gas pump. Nothing new on peak numbers, and two, why no decision on gas, even though I like having my gas pumped?
I appreciate that. Because I've got nothing new on it. I think, Judy, let me ask you a question. Cautiously optimistic. It's still in our control, folks, to either keep it optimistic or, please God, don't let your guard down. And when you look at the models that you look and I look and we all look at it, we're sort of in I would define the peak not as a day in time right now, but a period of time. And it feels like we're still in the thick of it. As I've said the other day, I mean, tell me if you disagree with, April is going to be our toughest period, assuming we keep doing what we're doing.
The press conference will begin in 30 seconds.
Good afternoon, and thank you for joining me. When I was inaugurated in January of 2015, Pennsylvania was at a crossroads. Back then, I asked Pennsylvanians to believe in their leaders, and I asked them to believe in themselves. I asked my colleagues to put aside partisan differences and deliver a better Pennsylvania to the next generation. We were well on our way. And although there have been bumps and setbacks, we reinvested in our schools. We pulled our finances from the brink. We began to modernize our workforce development system, and we reinvigorated our election system. Back then, when I asked you for your trust, your patience, your cooperation, no amount of imagination could have foreseen what I and reality have asked of you in the last month. I asked for you to close schools and businesses, to cancel large events, to stay at home, all in an effort to simply keep our friends, our neighbors, our families, our co-workers alive. And that request cuts deeper than just a change of routine, and it brings worry, anxiety, and distress. But there is no higher service than helping each other survive. And I will be forever grateful for your courage, your compassion, and speed as we prepared. Despite uncertainty, Pennsylvanians acted collectively, not because of any order, but because we care deeply for each other. Now I'm asking again for you to believe in our Commonwealth. This time I'm asking you to stay the course. Before we can build a better Commonwealth, we need to protect our friends and our neighbors. And what you're doing is avoiding the most catastrophic of circumstances. But our ability to prevail remains tenuous. We still rank 5th in the nation for confirmed cases. 42 days have passed since we identified the first COVID-19 case in Pennsylvania, and we began our aggressive mitigation efforts. And every Pennsylvanian has made sacrifices. The bars and restaurants that used to be an escape for us, they're closed. We canceled concerts, basketball games, weddings, family gatherings. We closed schools. Entire sports seasons were wiped away. Ceremonies and performances were abruptly canceled. We implemented a no visitor policy in our correctional facilities and nursing homes. We can't visit our most vulnerable friends and family at our most fearful time. We closed thousands of businesses. Hey, I owned a business my entire adult life, and I know that your coworkers are not just your colleagues, and that your business is not just a building or a paycheck. It's a way of life. It's a family. It's a group of people you spend more time with than anyone else. It's a support system. It's comfort. It's stability. And we asked Pennsylvanians to stay in our homes for weeks, leaving only to get essential items like groceries and medications. These efforts have shown signs of success and gave some security and safety for those who have been otherwise or would otherwise have been afflicted by this virus. We have not had the explosive growth experienced by our neighboring states, thanks to your sacrifices. And because of our collective efforts, we will likely avoid the hard reality that we've seen in places like Italy. But we still have between 1,000 and 2,000 new cases every day. And we have a national shortage of testing materials. Many patients who contracted COVID-19 1 or 2 weeks ago now need hospitalization. And more families all across Pennsylvania are losing their loved ones. But even amidst this despair, I have hope. We Pennsylvanians are tough. We're steadfast. We're resilient. And over the next few weeks, we will need to continue our social distancing efforts while we continue to plan for a phased reopening. But it's not the time to become complacent. And as we remain steadfast, I'm asking you for hope and the fortitude to protect our Commonwealth and belief in a safe and prosperous future. There is no magic wand to wave to get us back to where we want to be. I will work every day to repair the damage this virus has caused, and I'm going to fight every day to keep Pennsylvanians alive. I want to get started on the work we need to do to rebuild a new Commonwealth and get back on our feet again. But before we collectively do so, I want to share with you a plan for relief, reopening, and recovery. The challenges before us look insurmountable. While we have worked very hard to provide relief, we still have a lot of work to do. We've had more people file for unemployment in a shorter time frame than ever before in our history. I am working to bring our customer service up to meet this challenge. We're bringing on more staff to answer calls. We're using new technology to get through phone calls. And soon business owners and freelancers who have never been eligible before will be able to apply for unemployment. We stopped tax enforcement actions, liens, and penalties. We've changed the tax deadline. We're working with banks, the courts, and the Attorney General's office to protect people from foreclosures, evictions, late fees, and more. We've worked to provide millions of additional meals. We cut red tape so people can get food benefits faster. And we're investing millions of dollars to make sure people are able to access nutritious food for free. Student loans through federally backed programs or the FIA program have deferred payments. It's just a start, and we're going to work every day to make sure every Pennsylvanian gets what they need during this difficult time. Never have we had a forced stop of our economy and our workforce. Pennsylvania's businesses are in an unprecedented position. Many shuttered across the state to protect against the spread of the deadly coronavirus. Others changing their entire business plans around to help meet the many needs of people across the state and protect their employees and their customers. We created a state business loan program, and we're working with the federal government to make sure their small business loan programs works. But we need to do more. Our hospitals have borne the brunt of this pandemic, and we need to do more to assist and improve that healthcare system. We made every possible effort to slow the spread of the novel coronavirus and ensure our healthcare system can withstand the ramp up, the surge, and the aftermath of this deadly pandemic. We've provided $450 million by creating the Pennsylvania Hospital Emergency Loan, or the HELP program. And we worked with the legislature to transfer $50 million to purchase medical equipment and supplies for hospitals, nursing homes, and emergency workers to help fight the COVID-19 pandemic. Throughout this crisis, our healthcare workers have been heroes. From the nurses, to the janitors, to the doctors, to the thousands of support staff, they have kept our hospital systems running as admissions have surged. Our researchers and our universities are seeking a vaccine and changing their materials programs to make masks, gloves, or gowns. We've seen the best of Pennsylvania in our healthcare workers, and we need to repay them by staying home, by staying safe, and by supporting their efforts. We've done our best to provide relief, and we need to start talking about reopening. Last night, President Trump laid out guidelines for reopening America. And for weeks, my administration has been at work on a plan to reopen Pennsylvania. And we're going to make sure we have a plan that respects the reality of the situation on the ground and that works with our local, regional, and federal partners. All of us are anxious to reopen the Commonwealth. As a former business owner, I deeply share the concerns of some in the legislature, but we cannot exacerbate the pandemic's damage on Pennsylvanians and their lives. We need to be careful and deliberate. We need the flexibility to react to new outbreaks. Unfortunately, we cannot flip a switch and reopen the Commonwealth. There isn't going to be one big day. We need to make smart, data-driven decisions. And we can't be impulsive. We can't be emotional. We need to follow the science. So when we reopen, we're going to do it with the following standards. First, our approach will be data-driven. We will rely upon quantifiable criteria to drive a targeted, evidence-based regional approach to reopenings in Pennsylvania. Second, we will put forth guidance and recommendations for employers, individuals, and healthcare facilities for assured accountability as we reopen. Third, reopening necessitates that adequate personal protective equipment and testing are available. Fourth, reopening requires a monitoring and surveillance program that allows the Commonwealth to deploy swift actions for containment or mitigation if it's necessary. Fifth, protections for vulnerable populations must remain steadfast throughout the reopening process, such as limitations on visitors to congregate care facilities and prisons. And sixth, limitations on large gatherings unrelated to occupations should remain in place for the duration of the reopening process. These are actions we are undertaking and the standards we're going to use to make our decisions. Next week, I will be outlining more specific steps on the reopening process as we work with experts in public health, agencies, and stakeholders to determine how to safely reopen our economy. There's not one policy or one answer or one ideology that can solve all of our problems ahead on the road to recovery. But I am offering the framework of a plan to increase wages for all Pennsylvanians, to enact better worker protections, expand paid sick leave and family leave policies, and increase safe, affordable, and high-quality child care. We need to strengthen the unemployment and workers' compensation insurance systems. Let's expand student loan deferments to provide relief for individuals who are on the front lines. And we must expand rapid reemployment programs to support businesses and workers affected by mass layoffs. This pandemic caused significant hardship for many Pennsylvanians, but it also revealed underlying hardship for many. The countless workers who deliver food, who stock shelves, who work a register have always been essential to our economy, but never has that been more clear than now, how essential they are to to our way of life. They've put their health on the line to make sure we have essential supplies. And while they certainly deserve our gratitude, they also deserve a living wage. As Pennsylvania's economy recovers from this virus, thousands of Pennsylvanians will face a road to recovery of their own. As of today, there have been nearly 30,000 cases of COVID-19 in our state. The vast majority of those patients are going to recover, but this virus is new. We don't yet know much about what, if any, long-term effects it will have. We should change the law to give Pennsylvanians the peace of mind of knowing that no matter what happens at the federal level, they will not be denied health insurance coverage due to a pre-existing condition like COVID-19, or subjected to arbitrary lifetime or annual caps on care. Some industries have been hit particularly hard, such as hospitality, childcare, and manufacturing. We need targeted programs for each of these to help them get back on their feet. And we need to think beyond this crisis so that we build an economy that's stronger and more resilient. For our hospitality industry, we must pass rigorous financial support for small businesses, both short-term to limit the number of businesses closing their doors for good while we shelter in place, and long-term as small businesses restructure and recover. Child care providers, many of whom already earn disproportionately low incomes, have been forced to close all across the state. Some advocates believe that more than 1/3 of child care providers will be forced to permanently shut their doors due to lack of revenue. And yet, we know that as the economy begins to come alive again in the future, we're going to need child care providers to help us care for our children so that we can return to work. We must ensure their wages are fair and the protections are in place for providers in the future. And let's not forget about the importance of our agriculture industry, our farmers. They suffered a severe disruption in our supply chain. Recovery must ensure that certainty and the future of Pennsylvania's agriculture industry to continue to produce a safe, secure food supply. And lastly, it's past time to invest, upgrade, and extend Pennsylvania's broadband network to ensure all Pennsylvanians have access to the internet. It's smart for businesses, it's smart for schools and for people. There are going to be many more ideas on how to recover and how to reopen. These are mine, but I don't have a monopoly on good ideas, and I'm going to need everyone to contribute to our recovery. Each of us, we are each in control of our destiny. Pennsylvania can alleviate this crisis if we choose to do so. The standards and actions I've outlined can help people safeguard our health care system, and it can help jumpstart our economy when the time is right. But moving to reopen large swaths of our economy now, or reducing our flexibility to respond, it's only going to prolong this crisis. So let's focus on things that are productive to save lives and get our economy back on track when the time is right in a measured way. For years now, the legislature and the administration have worked together. And just recently, we moved our primary election system to keep voters safer. We also created a loan program for small businesses and a fund to prepare our hospitals for the surge. So I'm asking the legislature to work with me to build on this success. Because right now, I need your help. And right now, we're not Republicans and we're not Democrats. All of us, we're Pennsylvanians. And Pennsylvanians deserve and should expect nothing less throughout the life of this crisis. We Pennsylvanians are innovative. We're strong. We're survivors. We Pennsylvanians have set the course of the nation. We stopped previous pandemics in their tracks. We've built machines that have won wars and changed economies. I think back to our predecessors who were met with similar crises, and I can only imagine that they looked to our Commonwealth with hope and pride and optimism. In my 5 years as governor, I have never been more proud of our Commonwealth, and I have never been more lifted by the spirit of our people. Nurses, doctors, grocery store workers, transit workers, police, EMS volunteers, those who have fought through the fear and fog of uncertainty. Manufacturers who have changed their businesses to help provide those on the front lines with what they need. I look back in our history and I see setbacks. I see pain. I see challenges that looked impossible. I see pandemics and wars and recessions. But each time, Pennsylvania has risen. Each time, Pennsylvania has not only pulled itself up, but it has led the nation. We cured polio. We armed our nation for world wars. We mined. We built. We sacrificed. Let's be that example again. Let's stay home, stay safe, and then let's lead. Let's build. Let's change the world around us. Thank you, and God bless the Commonwealth of Pennsylvania. Now I'll be happy to take questions.
Good afternoon, Governor. Your first question is from WBRE. They ask, the number of new cases reported last week is down, but aren't fewer tests being reported as well, and aren't a greater percentage of those tests coming back positive? 20% of current cases are testing positive compared to about 12% positive at the beginning of the month.
I think you're pointing out a really interesting anomaly in the statistics, and we suspect, although we don't know, but we suspect that there was some lag in terms of the testing results as a result of the holidays, had Good Friday, Passover, Easter, and so we suspect that there were fewer tests actually taken. We also suspect there was maybe a bunching up, sort of a data dump in terms of test results that came from laboratories that might not have been keeping up on a daily basis. So what we're tracking is a moving average rather than a daily average of cases. But in our sense, what we've seen is a flattening, that the rate of increase has gone down. We still have more cases every day, but each day over this 7-day moving average, we see a gentle decline in the rate of increase, and that's heartening. It's too early to declare victory, but it's good news.
The next question is from Penn Live. Governor, is there any consideration being given to lifting some of the restrictions, such as ones that bar hospitals from performing elective surgeries, in parts of the state where the number of COVID-19 cases are low? You initially used a measured approach in putting mitigation efforts in place, a few counties at a time. Why not use that same approach in removing them?
It's a great point, and again, next week I'll be talking about more specifics when we talk about reopening, and I think that's the appropriate place to talk about that.
From ABC 27. Governor, it has been suggested that since you closed counties one by one at first, depending on the number of cases, do you foresee opening counties up as their risks decline? Some lawmakers argue that rural counties like Perry, Jefferson, or Elk, which don't have a lot of cases and don't have population density, should be able to reopen more quickly than some of the places that are more hotspots. What do you think about that?
It's again a very good point, and I think there's no question that the different parts of Pennsylvania have been feeling the impact of this disease differently. The East has felt it differently than the West, or the north central part of the state. So, as I said in my comments a few moments ago, when we get to the point where we're ready to reopen, it has to be a staged approach, and it will be.
From WTAE, in 2017, the Auditor General released an audit pointing out that the UC computer system was, quote, woefully outdated, with the potential of putting the entire system at risk. Can you say why the new computer system is still not operational 3 years later?
Well, first of all, we agreed entirely with the Auditor General and sued the vendor, and so the system we have in place now is not that system. And we have improved it. The problem is not the system right now. The problem is that we've had a huge influx. At this point, 1.45 million initial claims since the COVID-19 virus began. That's just a big increase. And so what we're doing is investing in new technology. We brought a bot in to work on our online system. We have brought many more employees to work in the call center to try to reduce the time it takes for people hanging on the line. We've increased the number of people working in processing to make sure that not only are people able to apply, but that they, once the application is in, it's processed in a timely fashion. And we've even added people in our mailroom at the Department of Labor and Industry. We still have a ways to go, and I acknowledge that we have disappointed far too many people. It's something that I am very interested in improving. We will continue to work very hard in the Department of Labor and Industry and throughout the administration to make sure that we are doing a better and better job of serving the people of Pennsylvania.
From the Altoona Mirror, the pressure to reopen businesses appears to be growing. Are you concerned that the adversarial attitude that seems to be developing over this will lead to decisions that aren't based on science, whether from an impulse to compromise or an impulse to stand your ground?
I'm not sure whether there are people who are willing to ignore science. I think all of us, I think we have 12.8 million Pennsylvanians, and all of us, I don't care what your political persuasion is, your ideology, we all want to get back to where we were. We all want to get back to work. We all want businesses to reopen as quickly as possible. Again, the challenge is we also want to keep people safe. And we are trying to steer the fine line between those two, the goal of keeping people safe and the goal of getting this Commonwealth back on its feet. And we've got to do that, as I said earlier, in a measured, evidence-based way. And we will do that. And in the meantime, I think we have to recognize that we're all anxious to get back to work. And we just have to make sure that we're doing this right.
From Spotlight PA, is there a specific benchmark for testing that the administration will require before it will begin reopening areas of the state?
Again, we haven't, and I don't know of any state or the nation that has actually established a specific target. We're learning new things each day, and the capacity for testing increases each day. I think we know that we're not where we need to be in terms of that capacity. We're not yet at a point where we need to know exactly where we need to be in terms of testing capacity to feel comfortable. I think, and again, this is an issue that affects every single individual. What do we need to make sure that each of the 12.8 million Pennsylvanians is comfortable going back to work or going to a store or going to a restaurant? Those are the things that we have to decide. We have not yet, but we will.
From WBRE, we're told the board of the Mohegan Sun Arena in Wilkes-Barre Township will vote on whether to approve a contract that would let mobile testing take place there. Will that testing site open this weekend regardless if a contract is in place or not?
No, I think I'm not a lawyer, but the board does have to approve that. I think they will vote today as to whether they do that.
From the AP, do you feel as though the White House is putting the onus on increasing testing entirely on states? Is the federal government's role crucial in increasing testing capacity?
Those are two questions. Second question is, I think the federal government does play a very important role in increasing testing capacity. I think in terms of whether they're placing too much stress on the states, I think they're actually trying to enable the states to do everything we can to increase testing within our state borders. But I think they're also focused on trying to increase the ability of all Americans to get the testing we need and build that testing capacity as quickly as possible.
This will be our last question. It comes in from PA Post. President Trump today tweeted, urging people to, quote, liberate Minnesota, Virginia, and Michigan, all states where people have protested against restrictions this week. In Pennsylvania, a protest is scheduled in Harrisburg Monday for the restrictions here. What impact do you think comments from the president are having on states?
I don't know what impact that has. I think that's up for the people who actually do the protesting. This is a democracy, and this is something we ought to do. Again, I think every single American, I know every single Pennsylvanian is eager to get back to work. We're eager to reopen, and I'm included in that. So we are working, all of us, as hard as we can to make sure that we reopen as quickly as possible. Again, what we don't want to do is reopen and then be hit by this virus in a way that overwhelms our healthcare system. Right now, I think we're making good progress. And let's continue to make this good progress in keeping people safe. And then, when the time is right, we're going to reopen and we'll liberate every single Pennsylvanian.
Thank you, everybody, for joining us today. That will conclude our press conference.
Thank you.